Forgetting things occasionally is a normal part of life. But what if memory loss becomes so severe that it affects daily activities, decision-making, and even recognition of familiar people? This condition is known as dementia, and it goes far beyond simple forgetfulness. So what exactly is dementia? Dementia is not a single disease, but a group of symptoms that affect memory, thinking, behavior, and the ability to perform everyday tasks. It occurs when brain cells become damaged and lose their ability to communicate properly. In a healthy brain, neurons send signals efficiently, allowing you to think, remember, and make decisions. In dementia, this communication is disrupted. As more brain cells are damaged, cognitive functions begin to decline. There are different types of dementia, with Alzheimer's disease being the most common. Other types include vascular dementia, caused by reduced blood flow to the brain, and Lewy body dementia, which involves abnormal protein deposits in brain cells. Each type affects the brain in different ways, but all lead to a decline in mental abilities. The symptoms of dementia usually develop gradually. Early signs may include memory loss, difficulty finding words, confusion, and trouble concentrating. As the condition progresses, individuals may experience difficulty recognizing people, making decisions, or carrying out simple tasks. In advanced stages, they may require full-time care. Dementia can have several causes. It is often associated with aging, but it is not a normal part of aging. Risk factors include genetics, cardiovascular health, lifestyle, and environmental factors. Conditions that damage blood vessels or brain cells can increase the risk. The understanding of dementia has improved over time as scientists studied brain function and identified the changes that occur in different types of the condition. Dementia not only affects individuals, but also has a significant impact on families and caregivers. It can change behavior, personality, and the ability to communicate, making daily life challenging. While there is currently no cure for most forms of dementia, treatments are available to help manage symptoms and improve quality of life. Medications may support cognitive function, while therapy and structured routines can help individuals cope with changes. Modern technology is also contributing to dementia care. Artificial intelligence and machine learning are being used to analyze brain scans, detect early signs of cognitive decline, and monitor disease progression. These tools can help doctors make earlier diagnoses and provide better care. Dementia is a complex condition that affects the brain's ability to function properly. Understanding how it works helps raise awareness, reduce stigma, and highlight the importance of early detection, healthy lifestyle choices, and ongoing research to improve treatment and support.